When you lose hormones, you lose protection. When you lose progesterone, you lose protection from osteoporosis, heart disease, high cholesterol, and much more. We have the ability to replace it. But what exactly is hormone replacement therapy, or HRT, and is it safe? In this video, I will discuss the difference between progesterone, the hormone that your body produces naturally, versus progestin, which is completely different, but commonly and mistakenly referred to as progesterone. So let's first talk about progesterone. When we replace this hormone naturally, which can be in the form of a pill, a cream, or dissolvable tablet, it is known as bioidentical hormone replacement therapy. Progesterone is very safe. It is even approved for over-the-counter use. However, I don't really recommend that because you don't know exactly how much you're getting, and it's important for you to follow the guidance of your healthcare provider regarding dosing and which route might be best for you. The oral route of progesterone is much more effective for sleep and anxiety and is not over-the-counter. If you don't have a uterus, but you've been told you don't need progesterone, that is absolutely false. If you have a brain, if you have a heart, if you have bones and breasts, you need progesterone. Progesterone is very calming. It helps with sleep, helps keep your estrogen safe, and it's a natural antidepressant. How does it keep estrogen safe? Think of estrogen like a little toddler who is playing nicely, and then she starts to get loud and obnoxious and is throwing toys that could injure others. Progesterone comes along and calms her down. If you don't have progesterone, those toys are like dangerous messages for your cells and can increase your risk of breast and uterine cancers. What about brain protection? Only the bioidentical form of natural progesterone supports brain health. It even protects damaged brain tissue from swelling and even death after head injuries, and is being allowed to be given as an IV without the patient's consent. Progestins, they don't do this. Progesterone has no serious side effects and is quite frequently even added to skin creams and cosmetics. But you don't know this because legally it doesn't even have to be on the label. For women, progesterone starts to decline in their 30s and often plummets down to zero after menopause. Replacing it can bring relief from things like moodiness, irritability, bloating, cramps, headaches, anxiety, and depression. Without any progesterone, you probably feel all of these symptoms, and also you're at increased risk of what it protects you from that I just mentioned a minute or so ago. Synthetic progestin, such as Provera, does not protect your heart and may be worse than taking nothing at all. Progestin is also what is in oral birth control pills, and it's also in IUDs. There is not a single birth control pill or IUD that contains natural progesterone that I'm aware of. And although progestins like Provera can provide uterine protection, it also comes with increased risk of breast cancer, heart disease, stroke, and depression, and it can cause weight gain, water retention, bloating, and breast tenderness. The harmful effects of synthetic progestin has been documented with over 20 years of studies. When it's dosed properly, natural progesterone has only one side effect when taken orally: sleepiness, which is why it helps with sleep and why we say take it at night. So to sum up the benefits of progesterone, it helps protect against breast and uterine cancer, osteoporosis, it improves heart health, sleep, anxiety, depression, and overall sense of well-being. For women who are still having periods, it helps with cramps, mood swings, heavy bleeding, bloating, and headaches. If you're curious if this hormone is right for you, come and see us for a consultation. You can call or text 512-580-4399, or you can request a consultation online at fitlogicfunctionalmedicine.com. We can see anybody in the state of Texas, New Mexico, Florida, and soon Arizona.